Wonderful. Good evening. And is there an echo here that I need to be concerned about? Okay, thank you. Welcome to the inaugural meeting of the Butte-Silver Health Study Advisory Committee. And we'll start off with a quick roll call, if we can. And then after that, follow up with just a brief introduction to each other about beyond the name, who we are. And so Dr. Cornell, I see that you're here. Eric Hessler, thank you. Joe Griffin, thank you, Joe. Joe Peterson, thank you. John Ray, thank you, Dr. Ray. Mick Smith. Is Mick attending online? A call. Do we have Mick Smith in attendance? Laura Twist. Dr. Webb. Les Cook. Jay Doyle. Good evening, Jay. Laura Williamson. Hi, Laura. Doug Quinsley, I believe, is not in attendance. Josh Bryson, who is being represented by another individual. Mike McAnulty. Is Mike McAnulty with us?
He's online.
Thank you, Mike. Mark Thompson. Hi, Mark. Dr. Yates. Thank you. Dr. Pullman. Dr. Pullman, are you online? And that is our committee. We have some other people who will be attending routinely from the EPA, Charlie Partridge and Nakia Green among them. From the state of Montana, Todd Harwell, who is the administrator of the Public Health and Safety Division with DPHHS. Will routinely have representatives from the Montana DEQ, I believe, but obviously, I don't think so this evening. Daryl, thank you for being here. My apologies. Maybe we could do a quick roll call on, have I missed anyone? Dr. Ward is online, so I think we're good. I think we're done with roll call, and obviously we'll have other people attending ex officio and in an advisory manner. The advisory committee was set up to give a little history. The RMAP medical monitoring group or effort has a work group that routinely talks about the medical monitoring studies associated with the RMAP program and the 5-year health studies that are issued related to that. In a de facto manner, that group became a forum for all things health study in Butte. That is not the mission of the medical monitoring work group, and it became overwhelming to the point where the medical monitoring mission of that group was not at the forefront. We do also have CTEC. Joe Griffin is very instrumental in that group, whose mission under the TAG EPA grant is to take very difficult and hard to understand health outcomes and environmental outcomes and explain them to a lay public. We felt the need, Butte-Silver Bow is a very studied population, probably because we're an anomaly in many ways in regard to where we live in the middle of a Superfund site. And a variety of health studies are routinely, health and environmental studies, I would say, are routinely carried out on our population and in our cities. So we felt that this group of experts, good people, community contributors, would be very healthy for our community in regard to discussing and analyzing the various health studies that are issued about Butte-Silver Bow, and then relay those to the public in a nonpartisan fashion. If we could go around the room very quickly. We've done roll call, but say a quick name and bio if you could, and we'll start with Eric.
Hi, my name is Eric Hassler. I'm currently the Director of the Department of Reclamation and Environmental Services for Butte-Silver Bow, and have been in the management role of the RMAP for about 20 years. So I have a lot of experience in and around the medical monitoring aspects of the Superfund process here in Butte.
Hi, I'm Joe Griffin. I was the former DEQ project officer for Butte Priority Soils, and I'm currently the vice president of CTEC.
Hello, my name is Mark Thompson. I'm the vice president of environmental affairs for Montana Resources.
Hi, I'm Joe Peterson. I'm retired. I worked for Bison Engineering for 18 years and graduated from Tech.
Good evening, Karen Sullivan. I'm the health officer for Butte-Silver Bow and the facilitator of this committee.
My name is Shauna Yates. I'm a family physician. Been in Butte for 15 years now and currently administrator of the Community Health Center, Southwest Montana Community Health Center. Thank you.
My name's Laura Williamson. I'm the state epidemiologist at the Montana Department of Public Health and Human Services. And my background's in chronic disease epidemiology, cancer epidemiology, although in this position at DPHHS, I get to do work on all public health diseases, including COVID-19.
Seth Cornell, I'm technically challenged apparently. I'm an internal medicine physician in the community, and I also sit on the Board of Health.
John Ray, I'm a professor up at Montana Tech. I'm currently on the board of CTEC. I'm vice president of Citizens for Labor and Environmental Justice, and I was a member of the Medical Monitoring Study Commission. Phase 2 report is being released, I think, soon, that looked at the efficacy of the RMAP program and found it was very efficacious. So.
And Dr. Webb, as a member of the group, I'll have you introduce.
My name's Kerwin Webb. I'm an internist. I've lived in Butte for 25 years and run a local urgent care center.
Thank you.
I'm Hal Robbins with Bison Engineering. I've been in the air quality business most of my life.
And I'm Steve Heck with Bison Engineering, and I'm a meteorologist.
Jay Doyle, would you like to provide a brief introduction, please? Jay, you may be on mute. Yes. I think we have captured every committee member that's here. If I have missed someone, please let me know. I see Dr. Ward is on as a presenter as well, but we'll have Dr. Ward introduce when he presents. So with that, I would like to call for any public comment on any item on tonight's agenda. I, as facilitator, because we have a lot to go through tonight and in our future meetings, will be holding public comment to 3 minutes. Thank you. Any public comment? I believe we're getting some technical things worked out. Okay, no calls. So with that, we'll move into our first presentation of the evening I'm not sure if Bison Engineering is presenting first or Dr. Ganesan, or whether it matters. Oh, Mark, okay. Sorry about that, Mark.
Thank you. I thought I'd just kind of kick off this presentation with kind of the statement of purpose and how this monitoring program kind of evolved. I'd like to start off first by, a very exciting announcement for the mine. We're coming up on 12 years without a lost time incident in the very near future, which is just an outstanding record, and it's fully attributed to our workforce and their efforts. So, but MR's dedication to protecting people's health and safety is not limited to just our workforce. We also are very concerned about any impacts that we may have to our neighbors and this community. And so in 2017, there was a paper published by Dr. Haler at Montana Tech that, among many other things, suggested that perhaps the ambient air quality monitoring being conducted in our community was not capturing potential exposures, was not adequately capturing potential exposures to metal-bearing particulate matter that's airborne. Dr. Haler's paper concluded that more data is needed to assess the potential effects of that. So we decided at Montana Resources we need an answer to this. And the first step to solving a problem is collecting data to understand the problem and then propose appropriate solutions. So what we did is we asked the gentlemen here, air quality experts from Bison Engineering, to help us better understand how to assess potential exposures to airborne metal-bearing particulate matter, and how can we better detect the sources of those, and then from that, we can then start looking at potential solutions to any problems. So in March of 2019, we started collecting data at the Ambient Air Quality Monitoring Station in Butte, which is located at the old Greeley School. We did this in consultation with the Butte-Silver Health Department that operates that station, and MDEQ, who is the regulatory authority over that station as well. And we asked if we could add additional equipment at that station to facilitate this investigation, and they were very gracious to not only authorize the addition of the equipment, but also assist in its installation and follow up with routine data collection off of it. So thank you very much for that assistance. And so we started collecting data, and we said, okay, what are these data telling us? And so then we asked Dr. Ganesan at Montana Tech if he could help us interpret the meaning of the data. And Laura, I don't want to steal your thunder, but at the same time, DPHHS used a subset of the data the earlier data that is going to be presented tonight, to also do an additional evaluation of potential health effects based on those data. So that's kind of the genesis of this project. The data collection is ongoing. We at MR have no intention of terminating data collection. As we speak right here, we're collecting data. We will follow the advice of Dr. Ganesan and Butte-Silver Bow Health Department and Bison as to, when they think that a sufficient amount of data is collected. So we have no intention of stopping until people that understand these issues better than we do advise us to do so. So with that, I'll turn it over to Bison, Hal.
Thanks, Mark. Appreciate it. I guess, as Mark said, we've been running this monitoring data now for quite some time, nearly 2 years. So it's kind of fun to be able to stop and look back at it and reflect on it and provide some summaries for everybody. Do you mind? Just point it at. Oh, sorry.
Nope.
Try it one more time. I guess it's getting there. There we go. Just slow it again. I don't mean this to be necessarily an advertisement for the firm, but in case you don't know who we are, we're an environmental engineering firm. We specialize in air quality. Been in existence since 1980. But Steve, again, is the guy who did most of the work behind it, along with obviously all the folks from Butte-Silver Bow and DEQ were very helpful. And Steve's the guy that does the work, and if it goes well, then I take the credit. If it's crappy, then he takes the credit. A little bit of history, a little bit of background about the Greeley site. Most of you, I think, probably know where it is, but it's where the old Greeley School is basically where the monitoring site is. It's been there for a very long time, even though the Greeley School itself was demolished in 2020. And monitoring has gone on there for years and years. Sometime in the 70s it started. I don't know the specific dates. And primarily we've been monitoring particulates, a little bit of other things, but primarily that. And what makes the Greeley site interesting, I guess, is the fact that despite efforts to the contrary, that's always seems to be the station that records the highest readings in Butte, at least for particulate. There's been a lot of studies over the years looking at different locations. DEQ did a fairly extensive saturation study, they call it, I don't know, 10 years ago-ish, something like that. And even with all that background into it and everything happening, Greeley continues to show the highest. Not necessarily, I'm not saying it's high in terms of bad, but it's the site that has the highest concentration. So that's the site that most of us start looking at. Next slide. There we go. Oh, backwards. Can you make it go faster? All right. Still going backwards. Okay. Sorry about that. The next slide, which is coming up, is just a Google Earth map showing where it is in case you were not aware of the exact location. It's pretty much in a residential kind of area. It's fairly close to the Montana Resources Mine, to my way of thinking, a fair distance from the interstates. But that's basically been the area of the subject. Should I be trying from here, or are you going to run it?
Let me run it on this side.
Okay.
We'll get there.
Okay, one more. That's the monitoring location. I think most of you knew, generally speaking, where it was. Before I go into talking about what some of the results were, I think need to back up and at least talk about the definition of things that we've been monitoring. Basically, when I say we, I mean the whole group of us, DEQ, EPA to some extent, Butte-Silver Bow, and ourselves. There's sort of three sizes of particulate we've been looking at. There's TSP, which stands for total suspended particulate, PM10 and PM2.5. TSP, total suspended particulate, doesn't actually have a size differential. It literally measures anything that really is suspended in the atmosphere. PM10, obviously by its name, measures 10 micron particles and less, and PM2.5 is 2.5 microns and less. And just a reminder, a micron is a millionth of a meter, or 0.000039 inches. And the way that the instrumentation, excuse me, separates PM10 or PM2.5 from the other particulate is based on aerodynamics, not really getting down with a little measuring tape and measuring, although you can do that with a microscope. But it's an aerodynamic sort of thing, which makes some sense because that's kind of how your mouth and your bronchial tubes and stuff does its own separation. But it does it via that methodology. Can you flip the next one for me? And just to give people an idea of the sizes that we're talking about, I just found a couple background information. For example, a grain of salt and a sheet of paper is about 100 microns. The smallest particle that you could probably see with the naked eye is around 40 microns. And so we're talking really small stuff. That's all I just want to impress on everybody. It's not big chunks of stuff floating around. We're talking very, very small stuff. And another good example to me is I think of light and wavelengths as being pretty damn small. And for example, the wavelength of red light is around 0.7 microns. So we're down into that really tiny area. Keep going. In terms of the monitoring station itself, the Greeley School site actually monitors probably more particulate than just about anywhere. There aren't many stations around the U.S. which has this extensive of a network in it. What's being monitored, as I mentioned before, PM2.5, PM10, and TSP. And meteorology is also being recorded, excuse me, wind speed, direction, and temperature. The items up there that are in the green is what we, Montana Resources, Bison, et cetera, have added to what was already there. So what was being monitored there was PM10 and a lot of PM2.5. But what's interesting to me, makes it interesting for analysis, and I'm a data kind of guy, we have hourly PM2.5, hourly PM10, hourly TSP, and we have metals in for all three categories. So it gives us a rare opportunity to look and see the relationships between all of them. Do you mind? Okay, enough background. Let's talk a little bit about what at least the particulate monitoring data is starting to show us. What's coming up here is the summary or the average of what has happened in the last I'm going to call it just 2 years of data. The mean is about 21 micrograms of TSP, but you can read it, I don't need to read it to you. What's interesting to me about it is that most of the particulate is in fact PM10. There isn't, I kind of thought in my head that there might be more TSP, relatively speaking, not necessarily TSP would be high, but I thought there might be more of a larger size that was floating around, but most of it happens to be in the PM10 range, and then half of that is PM2.5. Would you mind flipping it for me? This is just the same thing to show you in a graph what it looks like. I did want to mention that the units, if I didn't say already, are in micrograms per cubic meter. And of course that leads to the question, I mean, that's interesting, but is 21 a good number, or is it a bad number? And so for the particulate, we looked at, excuse me, there are some ambient air quality standards associated with all three of those items. Some of them are newer, some of them are older, but EPA and the state of Montana for a period of time either has or has had an ambient air quality standard for these particular items. And it's listed, it's shown up there in the corner of the graphic. And the PM 2.512 number is currently active. The PM 1050 is going away or has gone away. I can't remember which. And the TSP of 75 is long gone in terms of an ambient standard. It's been replaced by the PM 10 and PM 2.5. And again, these are all EPA numbers. And state of Montana had all of these as an ambient air quality standard. So I mean, I guess the good news is it looks pretty good all in all compared to those standards. And the last slide was a interesting one in the sense it shows you the average, but I guess the other question I would think is how does it change over time? Is it really high in one part of the year and low in another? And what we did here is plot that same information on a monthly basis. I didn't do it on a 24-hour because otherwise there's just so many numbers you can't see anything. But this shows a pretty good one, and it kind of mirrors what you'd expect from the average numbers. I think what I take away from it is it doesn't vary as much as I might have thought, or maybe I'm not sure never asked somebody here what they thought it might look like. It's fairly consistent. Interestingly enough, the summer-fall tends to be a little higher than the rest of the year. I guess the other thing of interest is looking at the peak, as it were. Again, they're not high numbers by ambient standards values. We're in August, September of 2020, and after looking at the data, I should say after Steve looked at the data, discovered almost every one of those high-ish numbers came from wood smoke fire season kind of thing. Also, I showed you a previous ambient standard. The ambient standard shown here is for daily numbers, and I guess you can see the numbers. All the values in the graph are far below what the current and historical ambient air quality standards have been. Having looked at some of the data itself, it's interesting to step back and ask yourself, what's the meteorology of the area? What do the winds look like? And so, again, you saw an earlier slide that we are taking, the state is doing it, meteorological data from the site, so we decided to look through that. And I have a couple graphs coming up of windrows to show you more, but basically the overall is that the winds are very light at Greeley School area. They're very light. They're actually about half of the airport. So, and then the other interesting part of it too, I thought was interesting, this is maybe just for me, was a lot of the winds have an easterly component. And when we talk about wind direction, just so we're clear, an easterly wind means the wind is coming from the east to the west, opposite of everything else that you talk about. You don't talk about, I was going to Great Falls as a southerly thing, you're going north. But in wind directions, they're a wind thing, that's the way it's done. Go ahead and flip, it'd be easier to explain this other one. This is a windrows showing what the overall winds look like for the 22 months that we've been running the site. You can see just by looking at it that most of the rows, as it were, has an easterly side to it. And the bottom graphics shows the wind speed at each particular wind direction. And those are probably hard to read, but the directions are actually or the speed is in meters per second, and roughly speaking, it's 2 to 1. Roughly speaking, there's 2 miles an hour is 1 meter per second, roughly speaking. Can you go to the next one? That was interesting, but the other stuff we started thinking about it, well, what do the winds look like when the particulate's really high, or what do the winds look like when it's low? And I'm using the high and low relatively speaking here. So we looked at the top 10% of the wind, or excuse me, of the particulate concentrations in the lower 10. And on the left side is a windrows of what happens when the TSP numbers are low. And when that occurs, it looks like the majority of the wind is from the northwest, maybe northwest, in that vein. During the highest TSP readings, the winds are pretty much east, or at least vary with an easterly component, which is, we're not sure what we would have expected, but it was interesting to take that information and look at it. In fact, we have it to compare it to. Having looked at the PM10 data itself, or all the particulate data, it's now time to kind of turn ourselves to what about the metals? That was an item of concern that people were worried about. And the problem we had with doing that initially, at least looking at the data is, what do we compare it to? For lead, in particular, there is an ambient air quality standard for it, that EPA and Montana DEQ has adopted, but there isn't for any of the other ones that we took an interest in.
How I interrupt it?
Sure.
I just got a text that you're breaking up online.
Okay. Maybe that's better. Ooh, I can hear myself. That's not good. That's okay. That's okay. Anyway, we decided what we would do is at least look through various agencies and see what they had for primarily looking at health-based standards, workplace standards, and risk kind of numbers to see what was available. And the long and short of it, though, is what we did is after we looked through all of the data that we looked at, if we had more than one agency suggesting a value, we always took the lowest number and decided that would be, for our purposes, that would be our guideline that we'd look at to decide whether something was perhaps high or perhaps low. And these are the primary agencies that we looked at for information based upon what I had before. We relied, and in the end, we relied a lot on the Department of Public Health later in it, after we received information from them. And EPA has a fair amount of information related to these kinds of things as well. A lot of that information was developed via Superfund and other agencies. Sorry, it's a little busy, but just wanted to show you these are some of the summary of the information that we had looked at for possible guideline values that we would take into account. And the numbers in the red are the ones that we actually chose. Go ahead. I know it's a little busy, but I always like to at least be able to have some sort of summary of what the numbers all said. And I'll get into some of the details of it, but this is basically a summary of what all the metals concentrations shown. Just so before you get too crazy with it, be advised that all the numbers except for TSP are in nanograms per cubic meter. TSP is in micrograms. And I only did that because otherwise the TSP would be written as 21,000 and 12,000, and it's easier just to keep them so they're readable. So anyway, that was basically a summary of the numbers that we actually had. Do you mind? The next one we decided, and again, I know this is busy, and certainly we can provide all this information if you want to. We thought it'd be interesting to at least take a gander at how do all these things relate to each other. And so we did just a simple correlation matrix to look at the correlation between the two. And what you're looking at is the R squared value, the Pearson correlation coefficient squared. The best way I describe the R squared number is, let's take copper and arsenic. That was actually the best one. That's a 0.57. Roughly speaking, that means that 57% of that data fits the notion that there is a correlation. Okay, my stats teacher might get a little tied up about that. But I mean, more or less, it's a good percentages. It tells you basically about 57% of the data fits, as I say, the linear model well. And got some other things on this, but the interesting thing about it was that none of them are really particularly outstanding. They're all pretty blasé, I guess I'd call them. Especially like cadmium, it didn't correlate with anything. And arsenic wasn't a whole lot better. There's a little bit there, but I think we can explain that mathematically later if we get to that kind of thing. And one of the reasons we think that they don't correlate as well as you might expect, or you might expect some relationships between here. And one of the reasons I think had a lot to do with this particular slide. This is one showing, and it was a little bit of a surprise to us, that it shows the percent of the number of samples in which the laboratory could actually detect. So in other words, let's take the copper one. Out of all the samples we sent them, roughly 100, I'm just looking at it, 90-some% of it, they found copper. The rest of them, they did not. And what's interesting is then look at arsenic and cadmium, and basically 95% of all the samples, they were not able to detect any on their samples. Manganese and molybdenum, lead, and zinc also are, I mean, they're low. They're apparently fairly low in the atmosphere, and that kind of messes up when you want to do the fun stats thing on it. When you have most of your data is all the same number, it takes all that that correlation stuff doesn't have quite the same meaning. But we thought that was very interesting. We were not expecting that to find that basically most of the metals data was not detectable by the laboratory. And I'm not saying the laboratory did a bad job. They followed all the appropriate things used all the time. Go ahead. That aside, here's a summary of all three of PM 2.5, 10, and TSP for 4 of the metals, so you could look at them side by side. And they're all just a little bit different. It looks pretty normal, or what you might expect, in that there's, in the TSP sample, simply because there's more of it, you would expect to find more of each metal. And for the most part, you do. You don't seem to see it in cadmium, and I'm just guessing that's because 96% of the samples were not detectable. And we just think that that has to be a big part of that reason. And the guideline numbers are shown up there on the left side, and they are all way below the guideline values. Rather than try to graph each of these by its own numeric value, because the guideline is so different between them, we thought we'd come up with this little plot which shows the values that we saw relative to the guideline. So it's normalized, if you want to call it, for each particular guideline. So in the arsenic data, for example, it looks to me about 18%, or the arsenic data shows about, the arsenic concentration was only on the average 18% of the guideline. And that's a little misleading, because one of the problems we had when I was talking about the fact that most of the data was not detectable by the lab, I mean, the lab has a minimum detectability value associated with it. And so when it tells you, I don't see anything, the lab, they tell you that I can't see anything below some value. It doesn't mean it's 0, it's just somewhere between I can't detect it, my detectable limit, and 0. And there's always a great debate, so what do you do for statistically and averages? We just chose to use halfway between the two. We just simply chose that whenever we had an undetectable number, we didn't call it 0, we called it halfway between the lab detectability and 0. And that's part of the reasons. It turns out that the arsenic guideline value is low enough that the detectability by the lab makes it look like there's something there when there really isn't, for all practical purposes. That was an interesting look at that over the long term. Again, as we did with the particulate, it'd be interesting to see what happens over time. And so these next 2 graphs show what happened over time. These are monthly averages. And they're also plotted as percent of the guideline. And they're all boring. They're pretty much, they don't change a lot over time. The only one, there's another graph showing the other ones. The only interesting one, I guess you'd call it the arsenic. There's a little blip there. And interesting enough that, well, let me back up. Out of the arsenic samples, there are roughly 100. And out of the 100, there are only like 3 or 4 which were detectable. And you can see which ones by the little blips there. And the biggest blip, and again, it's not a large one, happened during the wildfires. Go to the next one. Here's for the other metals that we looked at. More interest there, I guess, but nothing that seems to me scary. All the values are well below the guidelines. The only one you might look at is the lead. There's an ambient air quality standard for lead, and it's a 3-month average. And for whatever reason, the first 3 months had some numbers. They weren't that high, but they're half the standard. But that was the end of it. We have pretty much all non-detectable ever since. Steve and I have talked about why that happened, and we don't know for sure. We only speculate, but except we do note that on February, before we started the sampling, that was one of the coldest, snowiest months in a long time. And we're just guessing that by the time we got to monitoring in March, there may have been a lot of road dust and things could have left over from that. But again, we don't know for sure, but they don't, to my way of thinking, the numbers are not particularly, or as my doctor stuff always says, it's unremarkable. Next one. So just to sum it up real quick, we've been engaged in monitoring since March of 2019, we are more specifically dealing with total spent particulate and the metals of PM10 and TSP, and Montana Resources has funded it, and we've had a tremendous amount of help from DEQ and from Butte-Silver Bow. It made it way easier in our life and made it a lot more consistent, so we know that the samplers are being taken care of on all levels all at the same time. That's very helpful. The particulate concentrations are all below the current and historical federal and state air quality standards. The wind speeds are interesting, at least in the fact that they're so low in that area. And it was interesting to us that the high TSP numbers occurred when the winds were easterly, and the lowest ones occurred during northwest periods. And the metals concentrations were consistently below the guidelines that we had looked at. And the lead numbers are also well below the ambient air quality standards for lead. Just interesting, copper and manganese were the two metals that kind of tracked with TSP, the one I showed you, that 57% on the one. And interesting, cadmium and molybdenum didn't correlate with anything. Just whatever. And then I guess the final oddity was, I mentioned a couple times, is we were able to see things happen when the conditions were smoky. There was a little more TSP and PM10 and a little more of the metals. And that's it. Thank you very much. Thanks.
Thank you very much. And Dr. Ganesan will move right into your presentation. And I had on the agenda until 6:20. That will be an inadequate amount of time, I'm almost sure. And so we'll allow for going beyond that time, and I don't want to interrupt you in the middle of that. So we'll just make time.
Okay, thank you. Thank you for being here. Mark, as he said, he called me about almost a year or so, called me up and asked me whether I can take a look at some of the data that Bison has collected, particularly the PM10 and TSP and some trace metals. So when he told me TSP, I said, who is measuring TSP anymore? You know, people are forgotten about TSP, but there was a reason why we did that, because there was a possibility of the larger size particles that might cause some health problems. That's why they have started doing TSP. So my presentation is going to be focused on just the trace metals. Because I think you got a pretty good idea of what the TSP, PM10, and PM2.5 is, but I'm focusing just on PM10 and TSP. So the TSP and PM10 samples were analyzed for 7 trace metals. I put it in a little bit different order: the lead, arsenic, and cadmium. Those are 3 favorite of mine. They're more toxic than the other ones. Manganese, moly, copper, and zinc. Next one, please. So you heard the story. Bison did the monitoring. A third-party lab did the analysis, and data analysis done by Bison. They gave us a report, and we used the numbers in the report. And so my job was to actually give a review of what the data is telling us from an independent person from point of view. So it was challenging in 2014 when I had another report that we did for Butte, where we are talking about trace metals. And I kind of scratched my head, how do we compare these numbers to with what? We don't have standard for too many of those metals. And so we left it at that point, except that I got some data from a remote site around Helena called a background site. And we got some numbers out of that. And in 2014, if I remember correctly, our Butte numbers were some of those were very close to the background levels. Okay, it was pretty interesting. So that was one of the things. My preferred way is to, if we can find a standard, we can compare that standard with the metals we have in Butte. We are free home, but that's not really true for all the metals. So only lead has the ambient air quality standard from EPA, and the second choice is then, do we have some guideline values that we can compare that with the metals? And the third choice would be to compare results with other ambient trace metal levels. This has got a real danger in doing that. I do not prefer, because you don't know the location where sampled, you don't know the actual period, times, and the levels, and the methodology used. So those are all slightly questionable because sometimes they don't reveal all the information to figure out. But it does give you some information, indication, or a benchmark to see where we stand in terms of the concentration trace metals in Butte versus some other place. So next one, thank you. So like said before, lead is the only one who has ambient air quality standard. It's 150 nanograms per meter cube. By the way, nanogram is pretty small, 1 billionth of a gram, pretty small, tiny mass we are talking about. 90-day running average set by US EPA. Lead values measured at Greeley School from TSP and PM10 particulates were like 7.5 and 3.9 respectively. So they're pretty, if you look at that 150 and 7.5, pretty low, like already Hal said that a few times. So this is a pictorial presentation of what that 150 looked like versus what we really measured in Butte. So pretty interesting. The second graph is the TSP, and the third one is the PM10. Next one, please. Yeah. So I was hunting for more potentially standards. I couldn't find any standards, so I'm looking for other countries where they have any standards. The European Union has some standards for arsenic and cadmium, and for arsenic, they used 6 nanograms per meter cube annual mean, and for cadmium, 5 nanograms per meter cube annual mean. So I was able to, okay, at least I can use that standard to compare with what we have in Butte, Greeley School. The Greeley School arsenic is 2.5 nanograms per meter cube and 0.28 nanograms per meter cube. Again, you can see that very clearly that we are far below that standard is, by the way, is pretty stringent standard, European Union standard, as far as I can see. Another thing you want to be I think Hal presented that very well, but I want to bring it up again that when you analyze these trace metals, which are in nanograms, the instruments cannot detect concentrations. So you're looking at, if you look at the detection level for arsenic is 3.3, and your concentration is 2.5, what does it tell you? The instrument is not able to actually tell you what the real concentration is. We are kind of guessing. Like 95% of the arsenic samples were below the detection level. Okay, so I just kind of bring it up that we are actually fighting with the analytical methodology in terms of getting the levels we want to see in real. Next one, please. So it's kind of a graphical representation of the same information. The first one is the lead, second one is arsenic, third one is cadmium. You do not see any numbers next to TSP and PM10 on cadmium because those so small, they couldn't get in the graph. So they're pretty small concentration compared to the actual standards. Okay, next one, please. So since we don't have standards for copper, manganese, and moly and zinc, there are ways to compare, and Bison Engineering had come up with a pretty good way of comparing those. And I was digging for more information as to whether I have other ways of really comparing. Only way to do is to use my third approach, which is to compare with concentration in other locations. Next one, please. So the other location is, this is a published information on US, 3 different types of locations: rural area, urban, and industrial. So I'm not sure where we put Butte is. I would put Butte between rural and urban, or close to urban, whatever. I don't want to put it under industrial because those numbers are pretty high, as you can see. These are the actual concentrations being measured, and it's kind of a typical, what they call is a typical US ambient levels of metals. Okay, so the numbers on the parenthesis is numbers in Butte. So for lead, it is 3.9 in Butte, and we are far below even the rural for lead. And arsenic, 1.9, we are pretty close to the rural. Cadmium, 0.2, we are, again, very close to the rural. So that's what I was trying to see. Those are the 3 favorite metals that lead, arsenic, cadmium. They have more, toxic maybe. But so if you look at copper, we measured approximately 50, somewhere there, nanograms per meter cube. The rural had 10. Look at the urban, 290. So we are pretty close between the rural and urban for copper, and manganese as well as zinc. We are not in the industrial area at all. We are far below the urban even for copper, manganese, and zinc. Next one, please. Okay, then we have more information. If you dig through, we have more information. I just picked a few of those numbers that other countries in Athens, in Aquila, Italy, Lyon, Rio de Janeiro, and Mexico. You can see the ranges of concentration are pretty wide. Say for cadmium, 0.1 all the way to 9. In Italy, 3 to 6. And Lyon, 50 to 98, and in Mexico, 0.1 to all the way to 210. So our value is in the parenthesis on top is 0.2. So we are in pretty decent shape comparing to concentration other locations. Same thing with copper, also falls into pretty decent location, mostly on the lower end of the spectrum, so also manganese and zinc. Okay, so the conclusions are the ambient lead levels in Butte were about 20 times lower than the US EPA air quality standards, okay, 20 times. Arsenic levels in Butte were 3 times lower than the European Union air quality standard. As far as I know, that's a very stringent standard. Cadmium levels in Butte were 20 times lower than the European Union air quality standards. Copper levels in Butte were 6 times lower than the typical urban levels in US. Manganese levels in Butte were lower than the typical urban levels in US. And zinc levels were about 3 times lower than the urban levels in US. So in summary, you know, all these bullets are saying what we have done, what Bison has done. And the last one is, it is concluded that the trace metal levels in Butte are far below the air quality standards and are below the urban trace metal levels in US. Thank you very much for listening.
I know we're going to have questions at the end, but I do have one now. Dr. Ganesan, did you do comparisons to the rural standards? You compared there to urban?
Say it again.
Jason, if you could go back.
Yeah.
So we have a rural standard, I guess, an urban and an industrial, and you did a comparison with urban on a subsequent slide.
So these are actual concentrations measured in those areas, classified as rural, classified as urban, classified as industrial, from that paper, by the authors of the paper.
Okay. Jason, if you could go forward. One more. And so you, right here, you're...
So only from copper, we use that.
In the 3 lower bullet points, you're comparing to urban levels.
Yes.
Was there a comparison to rural levels?
Yes. We can compare that. You have a question, or?
The comparison is on the graph that Jason was on previously.
Okay, I'm sorry.
The values in the parentheses were next to the metal of concern, and then the rural value is underneath rural, so the comparison is right there.
Thank you. I'm in the remedial part of the room, obviously, so.
Thank you.
Okay, thank you for that.
Thank you.
And with that, Dr. Webb? Could we put the microphone in front of Dr.
Yes.
Webb so the audience can hear?
Hi, just wondering, are the sampling techniques pretty much, is that a standard deal? I mean, so these are comparable data sets?
Are you asking about, well, let me rephrase, the analysis that's being done at Greeley does follow standard EPA and Montana DEQ protocols, if that helps answer your question. I can't speak for what...
For the other studies?
Yeah, I can't speak. Well, certainly all the US data, I'm positive, is the same methodology. I'm positive of that.
Okay.
With that, and we do have questions, time for that at the end, and I violated that, but I did, before your slides went away, I wanted to address that, and thank you for doing that. We'll move now to Laura Williamson with the state of Montana and her presentation.
Okay, I see my slides coming up. All right. So my name's Laura Williamson. I'm the state epidemiologist at DPHHS, and I'm going to present an analysis we did of the air data that Bison Engineering collected. And so before I launch into my presentation, I just want to disclose that my husband works for Bison Engineering, and he performs the QA/QC on audits at the air monitors at Greeley School, but he does not analyze these data that are collected by Bison. Likewise, I did not participate in the development or review of this report. So we can move on to the next slide, in which I want to acknowledge our state toxicologist who was with the department from 2017 to 2020, Dr. Matt Ferguson. He actually was the lead report author and data analyst for this report. And then we worked quite closely with the staff at the Region 8 office for the Agency for Toxic Substances and Disease Registry, or ATSDR. Next slide. So just by way of background, the role of DPHHS in this project is, we're pretty new to being an agency that's showing up at Superfund related meetings, especially in Butte. And we didn't have staff capacity or funding to do work in this area until very recently, until 2017, when DPHHS was awarded a cooperative agreement with the CDC's Agency for Toxic Substances and Disease Registry. And so what that cooperative agreement allows us to do is we now have 3 people on staff that have expertise in this area. So we have a toxicologist, a human health risk assessor, both of which we've had on staff since 2017. And then in 2020, we were also able to hire a health educator. And so these staff work in Superfund communities throughout the state, not just in Butte, and we do the work of ATSDR in Montana. And so it's no longer being done by our federal agency, it's done by the state agency. However, we work in very close partnership with ATSDR. So we do health consultations, technical assistance, which is what this analysis falls under, and then also exposure investigations with ATSDR. And so all of our work undergoes scientific review and clearance by CDC ATSDR staff. So the purpose of this analysis was really to help Butte-Silver Bow Health Department address the community worries about continued heavy metal exposures in ambient air. Next slide, please. And then I think I've got some animation here. So the data sources that we used were the ambient air data that were collected by Bison Engineering at Greeley schools. And we looked at the data that were collected from March through September of 2019, so 7 months of data. And then we looked at these data and compared them to what we call comparison values, and these are health-based screening values. And we looked through the literature to find the most conservative or protective values that could be identified. And these would be values that in the literature or other agencies substantiated that there was some adverse health effects at those levels. And so these comparison values are considered to be protective for even the most sensitive groups. That would include children and the elderly. Most of our comparison values were for chronic exposure, meaning exposure for 1 year or more. And then when we were looking at the 24-hour averages, those comparison values were for acute exposures, which I believe are about a 2-week exposure. Next slide, please. So we conducted our analysis in March 2020. As I mentioned, we have scientific review by the CDC. So our analysis approach and the interpretation of the results were reviewed and cleared by ATSDR. And then we published this in October of 2020. So now I need to go to my notes because I am not an air quality expert. I'm afraid I might get lost in all of these data. But this is, we provided 2 tables summarizing our analysis. And so table 1 here is the average mass concentrations for each of the months that we looked at. And so each column in the data table is, first is TSP, then PM10, and then PM2.5. And we're reporting the average, and then in parentheses, there's the low and the high. And so with TSP, we compared that to the NAAQS 24-hour standard. And with all of these, the average was below the standard. And then with PM10 and 2.5, we looked at the WHO's air quality guidelines. And again, the averages were below those standards. However, we did find that in the 7 months we looked at, there were 3 occurrences where the 24-hour averages met or exceeded the air quality guidelines. And those occurred on 2 separate days, so on March 5th and May 31st in 2019. And so we wouldn't expect any harmful effects to the general population for exposures on those 2 days. However, there may be harmful effects in sensitive populations. Nevertheless, we would not expect harmful effects for either the general public or sensitive persons based on longer-term exposures represented by the 7 months of data that we looked at. And we can go to the next slide. So the next slide here, we're looking at, this is kind of a similar analysis as what we've been looking at with the previous 2 presentations. So we're looking at the average concentrations for each of the metals that were measured and analyzed. And so again, we've got 3 columns of data showing the average concentrations in the different size particles. And then on the far right-hand 2 columns is the CV, or our comparison value. And then we also cite what source we are using for that comparison value. And so with all of these metals, the average concentrations in all 3 size particles were below the comparison value. I do want to point out zinc. Zinc, as Dr. Kumar pointed out earlier, is a little bit hard. There is actually, we were not able to find a comparison value. So the studies are limited, and ATSCR's screening value has not yet been derived. So according to the literature review that we did, the lowest levels that showed no adverse effects ranged from 34 to 4,600 micrograms per cubic meter. So even though we don't have a CV for zinc, the ambient levels in Butte were still thousands of times below that of those reported to cause adverse health effects in occupational settings. And importantly, zinc is an essential nutrient, and people are normally exposed to zinc in their diet and in their environment. And then we also talk about in our letter, Health Consult, that the EPA speciated some data that was collected in Helena in 2018, and that data indicated that zinc levels in Helena were similar to those in Butte. Okay, so the conclusions from our analysis are first that for all average metal concentrations in the ambient air, none exceeded the health-based screening levels that we identified. Next. So there were 3 exceedances for PM10 and PM2.5 in the 24-hour air quality, or that exceeded the 24-hour air quality guidelines, and that was on 2 separate days. There were no or 0 days when short-term particulate matter levels were of concern for exposure to the general population. Next. And then the likelihood for harmful effects due to longer-term particulate matter exposures is low throughout all populations. So our recommendations are that highly sensitive people and parents of highly sensitive children should consult air quality forecasts, such as DEQ's Today's Air, and then use that forecast to perhaps reduce prolonged exposure or heavy exertion on those days when the air quality is poor. And then finally, we recommend that the health department, Silver Bow Health Department, should share these conclusions with the community. And I think that is, yep, that's all I have.
Thank you. And that really concludes the ambient air quality data summary report, and then DPHHS's data interpretation, kind of the first part of our evening. Moving into another part of the evening is Dr. Tony Ward's presentation regarding the source apportionment research work that he's done. And with that, we'll hand it over to Dr. Ward.
Hi, good evening, everybody. Let me try to share my screen. Can folks see that okay?
Yes, it's coming up. Give us one moment. Wonderful. Dr. Ward, I think we're good.
measured from the filters. All of those had concentrations that were above their minimum detection limits, except for potassium ion. And nitrate had the highest concentration of any of the ions, and then as far as looking at the organic content of the particulates in the air, they were heavily dominated by an organic carbon, which is a new carbon source, such as wood smoke, compared to elemental carbon, which is more of a fossil fuel or old carbon source. And here are the sources of PM 2.5 that were identified by the CMB model. And the highest concentration that was measured was apportioned to wood smoke as a source. And that could be during the winter months when it's really cold. That could be residential wood combustion. During late fall, early spring, that could be yard waste burning or biomass burning, or even prescribed fires in the area. So we just call it a wood smoke source. That was the largest source of PM 2.5 during the winter months. That was followed by diesel exhaust at almost 30%. The next largest one was ammonium nitrate. So that's a secondary air pollutant that essentially forms secondarily in the atmosphere, and it's a secondary indicator of a combustion type of process. The next largest source was unexplained. So anytime you collect samples or analyze the samples or run the model, you have some error that occurs. And sometimes that's accounted for when you do these types of modeling exercises. You can't apportion it to a specific source, so we call that the unexplained, at least for the CMB model. And then the other sources that were identified include street sand, and that's typically at the end of, very beginning of spring or end of winter when the ice is starting to thaw out a little bit. Automobile exhaust, and then sulfate, which is oftentimes either from fuel oil burning and sometimes diesel exhaust, depending on the community. So that is the different types of sources that were identified for this winter, with wood smoke being the largest source of PM 2.5, at least identified by the CMB model. And anytime you do any type of modeling, you always have to say, how accurate is the model? And one thing that the CMB model and EPA puts out is that there's certain targets that you have to be within, so you can say that your model is accurate. And for all the different types of EPA targets, the model for the 2019-2020 winter was well within those parameters. So we can confidently say that we identified the sources that were there and that we're confident in our findings. I will note that we had to throw out 2 sample runs. So instead of running all 16 runs, we used 14 24-hour runs in the model. We threw them out, one because it had organic carbon and elemental carbon were actually higher than the mass, which is physically impossible. So there was major questions about that run, so we threw it out. And then this February 3rd date had a negative PM 2.5 mass. So again, that's kind of impossible. So we threw those 2 sample runs out. But overall, we are pretty confident in the results that we're presenting with this model. And one thing that we did back in 2012, 2013 is we did a similar program for Butte-Silver. And using the same modeling, same Greeley school site, same analyses that were conducted, and essentially it's the same program that we repeated in 2019, 2020. So this is the data from back then, just for reference. And again, back then there was higher PM 2.5 mass. So instead of 7.1 from this last year or 2 years ago, winters ago, it was actually higher PM 2.5 during that winter. So 15.6 micrograms per cubic meter, but again, well below both the annual and the daily standards set by EPA. Highest source of, or the largest source of PM 2.5 during that winter wood smoke, and was followed by automobiles, diesel exhaust, so vehicular sources, ammonium nitrate, unexplained, and then sulfate and street sand. So very similar patterns. And when you compare the two models side by side, 2012, 2013 versus 2019, 2020, what I did here is these are all the sources that were identified by the model, and they were very consistent across both years, or both winters. This is the rank from 2012, 2013, 1, 2 through 7, and what the percent of each source, how much they contribute to the overall PM 2.5 mass. And for comparison, this is the results from 2019, 2020. So wood smoke was the largest source across both programs, or both winters. Automobile was second largest source in 2012, 2013, and this past winter, automobiles were the 5th largest source. Diesel exhaust is where we saw the biggest increase in overall percent contributions for the model. And then when you look at the ammonium nitrate, unexplained sulfate, and street sand, they're all fairly similar across both winters. In summary, it's a good thing that there is low concentrations of PM 2.5 during the winter of 1920. It makes it a little harder to run the models when it's such low concentrations, and that's why you're seeing a little bit of the elevated unexplained, because the concentrations were very low for the most part during the winter 1920. Similar to the previous source apportionment model, wood smoke was the largest contributing source of PM 2.5 during the winter, and like I said, that's likely residential wood stoves in the area during the cold winter days and winter months, and then yard waste burning and prescribed fires and slash burning during the late fall and early spring. And then the model did identify other sources during this past winter of 1920, with diesel exhaust being the largest or second largest source that was picked up. So that's all that I have, and I would be happy to take any questions.
And Dr. Ward, we're going to talk briefly about Butte-Silver Bow coming off non-attainment. And so if you could hang tight, and then we'll move into a kind of a Q&A and discussion framework, if that's okay. So thank you so much. And moving into, I want to look at the time, and we're a little ahead of time now, which is a good thing. And so I wanted to talk briefly tonight about the EPA proposal to approve the limited maintenance plan submitted by the state of Montana for the Butte non-attainment area for PM10, and then redesignate the non-attainment area to attainment for the 24-hour PM10 National Ambient Air Quality Standard. Written comments are taking place right now on that proposal, and they must be received on or before May 19. And so if written comments are to be submitted by anyone, they have to be submitted pretty soon. I do not believe, I know that we have Daryl Reed with us remotely, but the two air quality people that we had asked to be here tonight from DEQ could not be. John Rolich, did you want to provide some background on this and tell us what it all means and where we're going with it?
Good evening. I'm John Rolich, the Environmental Health Director for Butte-Silver Bow, and the good news is that we are most likely, it looks like, going to go from non-attainment for PM10 to attainment status, and give you a little brief background on how this came about. In 1987, the EPA put the Butte area air quality into a non-attainment for PM10. And that means we were close to violating the PM standard, 24-hour standard of 150 micrograms per cubic meter. So once that non-attainment came in place, and a lot of these non-attainments happened throughout a lot of the mountain valleys throughout the western United States at that time also. And so the state was then required to come up with a implementation plan on how to reduce the PM10 values and put forth some reasonable controls, and that took place on December 9, 1993. After that time, what happened was the initial SIP, and that again is the implementation plan, state implementation plan was approved by the EPA on January 1993, and it started going into effect on 1994. So what was done on this part is how do we get this redesignation from non-attainment to attainment? And the first major part of it, of course, is getting those levels down to below the 150 micrograms per cubic meter on a 24-hour basis. The other part of it is to have a SIP in place, and that was done back in 1993. And what the SIP basically does is have regulatory authorities, other things, and methods of reducing the emissions from the sources of PM10. And that can be, of course, wood smoke, road dust, industrial sources, things like that. So after that part of it is the EPA then determined that the improvement plan was working, and it had to have also a permanent enforcement and reduction of emissions. And then that final plan was approved in the late 90s on that part of it. So the good news is, and we've been looking at a lot of data, and I apologize, I didn't get a PowerPoint in place, but this is the documentation that is currently out from the EPA. You can go onto the EPA website to get this information on how the specifics for the limited maintenance plan, and that's the next step in getting off non-attainment along with our proper data. And we have to have a plan in place, the state has to have a plan in place that will kind of make sure that with a high degree of probability that maintenance of the PM10 standard will be maintained for at least the next 10 years. And the state has submitted that plan, and that's what's being reviewed right now. On that data, it shows, excuse me one second. That are highest concentrations, and they use the data from 2014 through 2019, and the maximum concentrations were well below the 150 micrograms per cubic meter for PM10. So on that part of it, that has been met. Again, the state submitted that limited maintenance plan, which has also been approved by the EPA. So the final step is public comment on going into attainment, which is a big thing for this community. I mean, you think about it, 1987, that is 34 years ago. That is a long time on this, so it is a good achievement. As you can see, the data from Bison Engineering, Dr. Ward's study, shows that, you know, our concentrations of PM 2.5 have been going down, which also will reflect that in our PM10 standards too, because it's part of the PM10. So I encourage you to write comments. This is a good day for Butte. Coming off non-attainment is a big thing, and we should celebrate it. So I'll answer any questions you guys have.
Thank you. I'd like to open the floor now to any discussion or questions related to the ambient air quality issues, or Dr. Ward and the apportionment study. And Dr. Ray, please.
I'd like to ask Ms. Williamson, with the conclusion of your analysis of the data from Bison and Dr. Gneeson's studies and so forth, you concluded that essentially, I may be overstating what you said, there's little concern or little worry about ambient air quality, ambient air in Butte detrimentally affecting the health of Butte residents. That's a general statement. Was any study done or any particular look taken at subsets of that population? For example, low-income citizens who, because of poor diets, lack of access, sometimes to medical care, other kinds of lifestyle issues, underlying health conditions, are more susceptible to the health effects of exposure to environmental toxics than, say, the non-poor or seniors or young children. So are there any attempts to break down this gross picture that it's not harmful to the public's health, to look at the effect of these contaminants on subsets of that population?
So the comparison values that we compared the data to, we came up with those based on a literature review, and so many of those values are derived from other studies in which they're picking the lowest concentration at which there's been documented adverse health effects, and these studies do take into consideration sensitive groups. And so from my understanding, Matt Ferguson and ATSDR felt that, at least, for what we know in the science, that these were the lowest concentration levels at which we might expect adverse health effects for sensitive people. And so therefore we took the data and we looked at it and compared it, to those low levels. So, we're looking at it to protect the most sensitive people. Does that answer your question?
So you did, or somebody did, look at the specific effects of these levels of exposure, say on the elderly or the poor or young children? Or is it simply an assumption, we've picked the lowest level, therefore by extrapolation they're protected?
So it goes back to how comparison values are determined, and so my understanding is that the literature supported that these were values in which there might have been some documented adverse health effects among sensitive populations. And so in essence, we are trying to protect, or it is protecting the most sensitive. I didn't do the literature review, so I couldn't give you specifics on exactly which populations each of those values were coming from. And science is messy, and so, each of those comparison values too are based on a different sets of studies that are looking at human studies, animal models, bench science.
Let me just say one thing quickly. When I said lack of access to health care, one thing I do want to point out is the tremendous effort and success of the community health services in reaching low-income citizens. It's just that in general, some may not have total access to health care, but it in no way was impugning the tremendous work the fantastic work, the super work that your group is doing. Well, but I did want to point that out, that one thing Butte can be very proud of, in addition to the work of the health department, is the work of the Southwest Community Health Center, is just providing so many essential services.
Dr. Ray, I also want to thank you for your particular bent, if you will, toward environmental justice. And I think this is becoming a bigger and bigger issue with the EPA, and I think there's opportunity in Butte to address that further and further as time goes on. We have a good working relationship with our EPA partners, and as time goes on, I think we'll be talking more and more about that, particularly since we know in Butte we have a higher childhood poverty rate than the state as a whole, a higher poverty rate, if you will, and to take a look at those issues holistically in the future, I think will benefit us all. So you're my environmental justice hero, so thank you for keeping us on our toes in regard to that issue yesterday and today and moving forward. Is there other discussion about tonight's presentations? I find great comfort from the data presented. I think Dr. Ward, you know, in regard to your study, both in 2013 and 2020, there's a good-looking difference between the wood smoke levels over the 7 years, and in a public-private partnership between Butte-Silver Bow and Montana Resources, we were able to carry out, you know, maybe 2015-ish, I want to say 2016-ish, a wood stove change-out program in the Greeley school neighborhood, because we knew back then that wood stove was a significant contributor, and we changed out about 50 old inefficient wood stoves for 50 EPA certified modern stoves. Would you like to address? Dr. Ward, can you hear us?
Yeah, I can hear you. I lost you there for a second.
Okay. I'll repeat. There's a significant difference in the wood stove, the wood smoke data in your study. And am I echoing? Okay. In 2013, when we saw your first study, you know, in a good public-private partnership with between Butte-Silver Bow and Montana Resources, we established a wood stove change-out program, changing out old inefficient wood stoves with new modern EPA-certified stoves. So could you address whether that probably, in my view, was impactful?
Source for each winter, the actual amount of particulate matter that was attributed to wood smoke was lower in this past winter compared to the first winter that we did this source apportionment study. So there is definitely an impact on something on wood smoke, and it was more than likely the wood stove change out that did the trick.
Thank you. Bison, Dr. Ganesan, Mark, Are there conclusions, and Laura, have continual input from our neighbors in the Greeley neighborhood. Maybe you can each take a moment to talk about whether the Greeley neighborhood should take comfort from the findings of the various outcomes we have this evening.
Well, I was really impressed with Kumar's comparison to the monitoring data that we've collected so far to rural and urban settings in the United States. And if you consider a very large percentage of the United States population lives in urban settings, and the monitoring data that's being collected now is less than typical urban settings, that to me says that Butte and the people in Butte have better air quality than a very high percentage of the rest of Americans in the country. I thought that was the first time I'd seen that, is when Kumar had made that slide, and I thought, wow, that is very striking, and that, to me, that was eye-opening to me.
Does the Bison team have?
I guess I would just say, sort of echo the same thing that Mark did. As we continue to do the monitoring, we'll keep an eye on how things are going, but I think we're all pretty pleased about what the results were, that they are, I guess we weren't sure exactly what to expect, but they are pleasing at this point. And I would like to make one additional comment that you brought up, asking about basically sensitive individuals and so forth. And I would just going through our old, or assuming what we had used for guidelines, and it turns out that of the 7 metals, 3 or 4 of them were based on EPA values, and the EPA numbers are what EPA calls their reference concentration. And I just happen to have the quote from EPA is, the reference concentration is an estimate with uncertainty added of a continuous inhalation exposure to the human population, including sensitive subgroups, that is likely to be without appreciable risk of deleterious effects during a lifetime. So at least there's some comfort in that. I'm not saying it covers everything. The other one, I'm sorry, is lead, and lead's an ambient air quality standard. And I do know that EPA does take into account the sensitive groups in terms of that analysis. And they're actually required under the Clean Air Act. The Clean Air Act requires that when you adopt an ambient air quality standard, it must be adopted with, the quote is, an adequate margin of safety. So, and I just know from historically that they do that. There's certainly arguments whether it's enough or too much, but at least there's an attempt to do that. I can't speak to the other metals, though, but I suspect that Laura's correct, that there is it's taken into account to some extent. Couldn't tell you the degree of it.
And I guess one thing I would note about lead is that I don't remember the year exactly, but today it's 150 nanograms essentially. Right. It used to be 1,500.
Dr. Ganesan and Mr. McGrath, as a neighbor of the Greeley neighborhood, we'll bring you up. I thought we could listen to Dr. Ganesan and Laura, and then have you come up to the microphone.
Thank you. I think for a community of Butte, compare that to 100 years of mining operations, reclamation, still activities going on. We have one of the best air quality. It's pretty amazing. So I think it is challenges to keep it the way it is or making it better. So I would say, I think the MR, the health department, and everybody else involved got a pretty good job, but I think you have to be very careful. You have to keep it that way, and so thank you for all of everybody involved in that.
And Laura, any final thoughts?
I mean, I think I would just reiterate some of our recommendations in terms of, there are days when we have unhealthy air for sensitive groups, and from, what Dr. Ward presented, it's probably from other sources like wood fire smoke, and so to keep for the Butte citizens to monitor what the air quality is predicted to be or is that day, and then if you are sensitive to air quality, to modify your activities for that day. So that's our major recommendation. But in terms of concentrations, metal concentrations, we looked at 7 months of data, and in the data that we looked at, we didn't find anything alarming or worrisome.
Thank you. Mr. McGrath, would you like to come up?
Hi, thank you. Steve McGrath, Greeley Neighborhood Community Development Corporation, Inc., Habitability and Mining Task Force. Firstly, I would like to thank Montana Resources for sponsoring this study and everybody who participated in it. It's very reassuring that the ambient air apparently does not pose a health risk. Our problem is that the ambient air just doesn't go away. The stuff accumulates in the neighborhood, 365 days a year, year after year after year, to the extent that we can collect samples of it, analyze it, and we see metals in there. And we think that represents a separate kind of exposure risk that we need somehow to get an assessment of. And, it involves not only getting an assessment, but also counseling people who may be vulnerable as to what they should do to avoid any adverse health impacts. So we'll be providing a formal response to the study, but I just like to thank you for conducting it and continuing to monitor the air. And we hope that we can proceed to a point where, we don't have any more health concerns. Thank you very much.
Thank you. Any other discussion about anything on the agenda tonight? Dr. Ray.
Oh, forgot there. Actually, I have a two-part question. One for Ms. Williamson, and it sort of piggybacks a little bit on what Mr. McGrath said. Are there any studies that look at the cumulative effect of, all right, the air quality study showed, to me, very exciting results, very positive results, that we now have data that substantiates tremendous air quality in Butte. But if you have a little bit of contamination coming from the air, a little bit of contamination that exists in the soil, a little bit of contamination that accumulates over time, is there any attempt, or have there been any studies or quantifying the cumulative effects over time of exposure to multiple toxics, that it's not just, well, one day we'll be exposed to lead, one day we'll be exposed to arsenic. There's a cumulative and potentially synergistic set of effects going on. Have those been analyzed?
So Dr. Ray, I am not able to answer that question. I'm going to have to bring it back to our toxicologist and risk assessor. That's really out of my area of expertise.
My second question, this is going to sound naive, but then I'm not an engineer or scientist. Why is Butte doing so well? And I don't mean that flippantly at all, because these are impressive findings, just as the declining lead levels in children because of RMAP is very impressive. But Butte had, over a century of mining, over 100 smelters. We got some deposits from the Anaconda smelter. They're naturally occurring heavy metals. We have active mining going on in the community, and yet, as you said, we've, based on these studies, some of the best air quality in the United States. And so I don't mean this at all flippantly, but why, what accounts for how well Butte has done in terms of its air quality? I don't know who to ask.
Is there any
I
expert
mean, the
in
wood
the?
stove thing is really important. What is it, the buyout, replacing for more efficient wood stoves. Certainly the RMAP program. MRI has done some outstanding work minimizing air emissions coming off of a very extensive active mine. But if somebody could summarize for me, because I know I'm going to get this question, can we really believe this glowing report if you look at Butte's history and you look at Butte's condition? I'm not saying can we believe it, but what accounts for how well we're doing?
Are there any theories?
I can offer a little bit on it. I mean, it has to me a lot, well, lots of things. I think the wood stove switch out is a big one. I mean, it really comes back to the implementation plan John talked about, and all the things that were done with it. It included reductions in emissions from Montana Resources, changing the sanding thing into more liquid I think made a big difference. There's more paving going on. The emission standards for automobiles has had a tremendous, nationally, I can't speak to Butte specifically. I mean, it's amazing when you look at the emissions from automobiles. There's, I don't know, I can't remember the number. There are like 10 times more automobiles than were a mere 20, 30 years ago, but there's less emissions. And doing that because of that sort of thing. There's I mean, the Rome-Pelong facility went down. I'm not suggesting they were bad, but I'm just, all those things together, I can't really paint it to one particular thing, but I think all of that went to do that. And it's not completely unusual. In the U.S., the ambient concentrations of most pollutants have gone down substantially since 1970-ish period, due a lot to the Federal Clean Air Act and state Clean Air Acts and so forth. I know it's very general, but I can't say one thing, but I think they all made a big difference. They all combined made a big difference.
Thank you. Dr. Yates.
I have one question and one comment. So the question would be around the current technology for us to, when we look at the DEQ and we're looking at air quality, is it the Greeley site that gives the air quality for Butte? If you were to look on the DEQ and ask for today's air quality?
Yes. Well, Cato, do you want to talk about that?
So the air quality, so if we were to monitor air quality for Butte, it was mentioned by Laura that would be one of the measures to know to help with your vulnerable populations especially. Is it the Greeley site that air quality measure is coming from?
Yes, Doctor. On that, back when the air station was put there, the DEQ, back then it was Department of Public Health. There was no DEQ. They were not separated. They determined that was the most accurate place for our worst air quality in our valley. And we did a saturation study back in, the state did a saturation study back in 2014. They had mobile PM10s set up throughout, I think 12 of them, ranging from East Junior High, Butte High, Clark's Park, all the way uptown, throughout the whole valley to determine if that still was our worst air quality. And that still was determined, that location, and it's just how the winds are associated with it. It is the lowest part of our valley. So yeah, that's why that station was put there, because of it shows our worst air quality in the Butte Valley.
And who monitors and updates that technology?
Who monitors? We have a continuous monitoring. We've had that in place. We continuous monitoring for PM 2.5 and PM 10. That's through the DEQ. We maintain it at the local level. We do the change out, And so we do have the BAM, which is the real time when you see air quality, air now on the DEQ website. That is from our continuous monitor, the BAM monitor. So that gives us real-time information, which is very vital, especially during wildfire seasons, because we can see how drastically that can go from severe air quality, hazardous air quality, and in 20 minutes, depending on a change of wind direction, to pristine air quality. So, you know, and then the last 2 years with Bison Engineering, MR, have set up the TSP monitoring and also a PM10 for speciation on that too. So.
I believe we have somebody remotely with a question.
Meeting will be on May 24th. For a week prior to, there will be access to the video and PowerPoint via BSB's Facebook page and website so that you can preview it before the start of the meeting. And then the night of the 24th, there will be a panel of stakeholders and citizens to answer any of the public's questions in and around the findings from the medical monitoring study that was conducted in combination between the Department of Reclamation and Environmental Services at Butte-Silver and the Health Department.
Joe, you want to add anything?
I guess it's pretty important to note in this health study, which the bulk of the real study was looking at blood lead levels of children in Butte, or blood lead levels altogether, but it's mostly children, that there were a number of us that were able to participate in all those sessions. So it's really has been a very good community effort. And there were at least 3 of us from Citizens Technical Environmental Committee that sat in on all of those sessions.
I did want to talk to committee members briefly about how you would like this to look. Initially, a year ago, you know, we had appointed all of you to the committee in February of 2020, and then COVID hit, taking all of my time exclusively, really. And here we are today with our first meeting. We have a couple of important studies that I think need to get talked more about, including a meconium study and a brain cancer study published by Dr. McDermott. And I think those deserve a forum for discussion and analysis. So I thought initially a year ago when we came together to be formed that a quarterly meeting would be in order, that we would meet 4 times a year. My idea with kind of the meconium and brain cancer work out there would be the potential of a June meeting, that we create a forum where we can talk about that, take the summer off, and then come back after Labor Day when things are back in order, and meet from there forward quarterly. Does that sound like a plan that is amenable to everyone? Okay, I'll shoot for a June meeting. These are publicly noticed under the Montana Open Meeting Law, and we'll do that. You know, we have other studies out there. The health department every 3 years conducts a community health needs assessment in partnership with St. James Healthcare. And certainly I'd like to talk about some of the outcomes there. Now that COVID is not so centric, don't get me wrong, it's still in the middle of everything, but it's really a pleasure to be able to think about other public health issues and the outcomes of our community health needs assessment, from, you know, the number of houses in Butte with firearms in them to our suicide rate to our teen pregnancy rate, I think deserve our attention. And so I'd like to bring that forward for a future meeting. Another example, we have pretty amazing data from our first year of our syringe exchange program at the health department. We change out dirty needles for clean. It's a public health effort, and some amazing outcomes about kind of that undertone in Butte that doesn't get enough attention. And so those are the things that are available to talk about and to let our community hear about and consume. And so I'll go to work on a June meeting and maybe make the meconium and brain cancer work a topic for that particular time. Then forget about things over the summer and come back after Labor Day. Any other comments? We do have a section on the agenda for public comment on any item not on the agenda. Dr. Cornell.
Thank you. And I wanted to thank all the speakers and MR for conducting this study. That was very informative. I'm wondering, would it be possible to get the full, thank you for sending out the summary study. Would it be possible to get the full study, the Bison study that goes over the QA and QC?
We do create quarterly reports for our client, and with his permission, we'd be glad to provide those to you. So it does have, then you have all the individual numbers if you want to look at them, and all of the QA, QC, et cetera.
Yeah, we circulate those quarterly reports to Karen and John and DEQ and of course Kumar. So you know, we can, I can get it to Karen, and Karen can distribute it to the whole committee if that's appropriate, if Karen believes that's appropriate.
I do.
And we have all those quarterly reports.
Yes, so we'll forward those out. Dr. Cornell also is a member of the Board of Health, and so the intent of the advisory board as well is to, you know, have a liaison relationship with the Board of Health. So with that, we'll make the full report available to you. I'll find the latest and greatest. I probably have a few quarters in my system and get that out to the group. With that, if we haven't had enough fun, it's only 7:45 and we can go have more fun. So thank you to the community members for serving and to the audience for your interest. Thank you.